Chris Williams. We're going to do, this is for week 5 health assessment lab. We're going to do musculoskeletal examination. I would begin with my ADET, so I would walk you through and say, hi, my name is Carissa, I'm going to be your nurse today. I would perform hand hygiene, my stage is over here. I would ask the patient for her name and date of birth, and I would check her wristband. Can you tell me what your name and date of birth is?
Diane Williams, February 23rd, 66.
Okay, that all matched. First, I would, since this would all be together in a head-to-toe checkoff in assessment, I would probably already done a full skin assessment for any bumps, bruises, lesions, edema, anything like that. So we're just going to go ahead and say that her skin is normal. For her age and ethnicity and everything looks fine. There's nothing weird going on, nothing that needs immediate attention or anything of that nature. And we're gonna also assume that before I was doing anything, I asked her if she doesn't have any pain, correct? She doesn't have any allergies, nothing of that sort. So we're just gonna get started on the inspection of her posture, position, and I'm gonna have her walk for a little bit so I can see her gait. So right now your posture is good. Could you stand up for me? You stand and you can just walk a few steps this way. You have good posture, your gait is fine, you're not using any assisted devices of that sort, so it's fine. You can sit down. We're next going to do your head, neck, and back. So first I'm going to inspect and palpate your temporomandibular joint, your TMJ. It's right before your ears. So first I'm going to feel it. Nothing feels out of place. Now can you open and close your mouth for me? Okay, that's moving like it should be. I don't hear anything, no pops, no creaking, nothing comes that feels like it's pulling out when I touch it, so that would be normal. Next we're going to check her back. So you can turn on this. Now normally the patient would have a gown on and you could be able to see their back. We're just going to leave hers on, but you would have it checked. You could feel for it. She's got a lumbar curve inwards like she should. Thoracic is slightly curved out, so she probably has just a normal S shape that you would view from this side, like good S shape. Bad S shape would be from this way. You don't want to see that. I could also have her bend all the way forward so you could feel them if you wanted to. You can if you want. You to bend down all the way forward and you could feel them. And if you really wanted to assess for scoliosis, you could feel all the individual vertebrae and you could pen mark them, and then they stand back up. It should be a straight line, but we're not going to do any of that right now. So that is all normal. I felt them, they all felt fine and as they should be, nothing sticking out, no weird lumps in there. It was all perfectly normal. Okay, so now we're going to assess for range of motion of her head and neck and back. So first we're going to do her head and neck. So if you would like to turn your head to the left for me, can you turn your head to the right? This is rotation. Okay, can you put your chin to your neck forward? That is flexion. Can you turn put your head all the way back? That's hyperextension. Can you do lateral bending one way or the other like this? Okay, good job. And you should also be able, we witnessed you bend forward. Can you bend back a little bit? Bend back. Okay. So you're gonna hyperextend your back. Okay. So your head, neck, and back, you have good range of motion. You have full range of motion there. And we're going to test your strength. So for your head, I'm going to put my hand here, and I want you to push against my hand. Like, turn your face against my hand. There you go. Same thing on this side. Okay, good. Good job. we're going to move on to her upper extremities. So this is all her arms and shoulders, elbow and hand, fingers. That's all the upper extremity joints. First, we're going to inspect and palpate joints for bilateral symmetry. You can also check, make sure that her shoulders are sitting at the same height when she's facing me. Nothing on her shoulder appears to be bulging out. You would check from this angle for any bursa swelling in her shoulder, which there seems to be none, and everything feels even. You check for any swelling in her bursa or any of her synovial joints by holding the wrist like this and feeling the olecranon and the epicondyles. We're going to check this side as well. Don't feel anything. We're going to check her wrist. No swelling in her wrist. None in her around her knuckles or metacarpals. None on any of her phalanges as well on the right side. Check the left side. I don't see any signs of rheumatoid arthritis or osteoporosis in any of those joints at all either. Okay, so now we're going to do range of motion for your upper extremities. We're going to start with your shoulders. So first we're going to do internal rotation, which is like this, backwards. Can you do that? Okay, that should be 90 degrees. And then we're going to do it up against your head, if you can do that. Yep, okay, that's good. Now we're going to see, can you put your arms all the way up? All right, and then can you put them back a little bit? Okay, good job. Can you abduct away from your body, this? Can you abduct back? And then can you put your arm in a circle, like motion? Okay. Can you do it on the other side as well? Yeah. Okay. So you have range of motion in your shoulders. Now we're going to do your elbow. This is much easier. All you can do is go in and back out. Can your other arm do that as well? In and back out. Okay. And now for your wrist, we're going to do a Phelan test. You do this. Okay, good job. Everything seems to be working. It's all good. And you also do a Tennille test, which you would percuss on her, I think your arm needs to be relaxed. Percuss on the wrist for carpal tunnel syndrome. You would percuss and see if there's any reaction there. Okay. We're going to do range of motion for your wrist. You should be able to do a waving motion in and out. You up and down. Okay, now we're going to do your fingers. Keep your fingers flat. Can you flex them down? Straight down. Okay, can you extend them? Just your fingers. Can you extend them back? Okay, good job. Can you go out with your fingers? Go back in. You fold your thumb across. Can you do this? And then fold your thumb over. Okay. So your range of motion in your phalanges seems to be good. Your wrists, your elbows, and your shoulders. Now we're going to do some strength. So I'm going to, so you hold your arm like this, and can you push down towards me? Okay. And then we're going to do the opposite. Can you pull up? Okay, we're going to try to do the other arm. Do against me. Can you pull up? Okay. And then shoulder, can you pull out? Do it out on the other side. And then can you pull down? Yeah, adduct. Good job. Okay. So her strength seems to be fine as well, and it's equal bilaterally. Same with all of her range of motions. Now we're going to do her lower extremities. It's going to be a little bit different. Normally you would do these maybe on a bed or a floor. We're going to try to do them on our chair since that's the angle we have with the camera the best we can. And if we can't physically do it, I will just explain what you should see. So you would inspect and palpate hips, knees, and feet bilaterally. So if you want to, we'll just put them out like this. Our makeshift bed. Normally for the hips, you'd be laying down and I would feel swelling around the hip bones or anything. We're just going to go ahead and say that they're totally fine, which they should be. You don't have any history of any hip issues or hip problems at all. Knees, you do have a history of a torn meniscus, right? And then you had it surgically repaired, correct?
Yes, my left knee.
Okay. So we know that there was a history of a knee issue there. I can see a little bit of a scar from that. And that's fine. You don't have any problems with it?
No.
Recurring problems? Okay. Once again, we already checked the skin. The skin color is even and it's all good. I don't see any edema or anything like that. So we're going to check for any swelling. You could do a bulge test and you push on one side and see if the fluid moves. That works for smaller amounts of fluids, and then the allotment test works for larger amount of fluid. But I mean, even for, I don't have any fluid at all in there, just a bulge test. So that seems fine. I didn't see any swelling in the bursa and none in that pocket above the knee. Ankles, there doesn't appear to be swelling either, any of that, and neither in any of the toe joints and the phalanges of the foot. Okay, now we're going to do some range of motion for the strengths, knees, ankles, and hips. So your hip should be able to, I don't know if you can do this sitting down, but you should be able to pull your leg up from a seat, from if you were laying down or from sitting. If you wanted, or you can stand, okay, yeah. So she can do that sitting down, so it's pretty good. Be able to do that, and then can you pull your knee to your chest, kind of like that, without assistance. That's good enough. So she's flexing her knee, and then she's being able to flex her hip. Can you internally rotate sitting down? Okay. Can you externally rotate? Can you do the other hip that way? Internal rotation and external rotation. Okay. And then, I don't even know if you could do this standing up, but you could technically circumduct your hip in a circle as well. Okay, so she can. That my mom. So you can circulate your hip as well because it is a ball and socket joint. It should be able to have a motion like that. Okay. So we did the hips. Now we're going to do your knees. You already proved to me that you could flex your knee and then you could straighten it again. Okay, you do both sides. Okay, and now we're going to do your foot. Can you do dorsiflex, which is put your toes up, and then can you plantar flex down, toes to the ground. Okay. And toes, most people don't really have any motion in their toes, so you shouldn't have any there. Okay, so you have full range of motion in that. We're going to, can you rotate your ankle? Okay, can you, it's inversion, you put your foot in, and then exversion, you can turn your foot out, not the, right there. Okay, do that on both sides. Okay, now we're going to try to do a McMurray's test, which we can't quite do this way, but it's for testing for a meniscal tear. You have the knee kind of bent, and you do like a twisting kind of thing with their leg, like in a rotation, which it seems really painful to me that you probably shouldn't do that. No, this hip stays straight. You rotate like this part, which seems really painful if you had knee pain. I experience knee pain, and I would not want somebody to do that to me at all. And mine's not even that bad, but still. So there's no locking, there's no giving in on our knee when you do that, so it's fine. We're going to do some strength tests for that. So we can do, okay, I'll have you turn to the side. I'm going to push down on your thigh, and I want you to be able to lift up. Okay? And then we're going to do the opposite. You're going to have it up, and you push your thigh down. Okay, and we're going to do the other side as well. I'm going to push up, okay, and then we'll push down. All right, and now we'll do a foot. You can have your feet up here if you want to. I'm going to push against your foot. You push down, you push up, push up. Okay. You have equal range of motion for all of your lower extremities, and you have equal muscle strength on all those with full resistance, as you should. When someone has full resistance against muscle strength, that's out of 5. That's the full level that you can do, and that's how it should be. And then I would note any pain, crepitus, edema, or injury, but like I said, you would do a full inspection probably, overall if you wanted to first, your head to toe, and I didn't notice any of those. there was no crepitus to be a crackling sound, no edema, or anything of that sort. So then I would do my Roth. I would ask her if she needed anything, if any pain came up. You're in a hospital setting, the call light would be within reach, bed would be lowered, rails up, a bed locked, and that would be the end of the assessment.